Hi, I'm Jake, and I'm going to be doing my intramuscular injection skills video. I'm going to go ahead and show the sides for this. So I do the for the deltoid, I'd find the combing process, create an upside down imaginary triangle, and administer right in the middle of the triangle. And then for the vastus lateralis, I would divide the anterior part of the thigh into thirds, horizontally and vertically, and I would do the outer middle third. For the ventral gluteal area, thank you. I'm gonna go ahead and kneel down to really show. Okay. The ventral gluteal, I would put my hand on the greater intracranial, I can't say that. With my index on the anterior superior iliac spine, and my middle finger on the iliac crest, and then I would administer in between my index and middle finger, so in between that triangle. Okay. And so during this injection, I would maintain my GPSP. I would verify my order, do my 11 rights, and my 3 safety med checks. Hi, I'm Jake. I'm being a nurse today. Can you tell me what your name and date of birth is?
JC Blanningham, 92304.
Do you mind if I check that?
That's fine.
Okay, awesome. So, do you have any allergies I need to know about?
No.
Okay, so I will do the necessary assessments before for administering this medication, or okay. Sorry, I'm gonna go ahead for my hand hygiene and put my gloves on. My gloves ripped, so I'm gonna imagine gloves, but they're gloves. And then I'm going to go ahead and I'm gonna go ahead and take a alcohol swab, and swabs in circular motions on the side. And then, I'm gonna discard that, and then I'm gonna let that dry. I'm gonna go ahead and open up my pre-prepared packaged syringe with my dominant hand. I'll safely remove that, discard that, and then I'm going to remove the cap. And then I'm going to administer this at a 90-degree angle quickly, and I would make sure that the bevel was up. Now I would slowly inject the medication, and then take it out. Take it out quickly. And I would pinch before doing this. Or actually, yeah. And then I'll take it out quickly. Put my safety on. Discard that. And then get my gauze out. Put my gauze in there. Apply light pressure. And then I would wait until the bleeding stopped, or check for bleeding. And I would discard this. And if need be, I would apply a bandage. And then so I'm going to take my gloves off, perform my hand hygiene, report, and then I would come back to evaluate my patient afterwards.